learn more about the tax credit, but we do hope that's not the only thing that brought you here today. We hope you're also here because you're committed to supporting employee and community health. And as you listen to our presenters, we'd ask that you think about ways in which MetroWest Moves can support you as you engage in your wellness efforts. This could include future events that we could host, resources and materials we can link you to, or connections we can help to make, as well as awareness we can bring to the work that you're doing. Before I hand it over, I just want to let you know a bit about who you're all going to be hearing from today. So I'm going to start on the far left. We've got Bobby Orsi, who's going to share some background on the tax credit, as well as an overview of the credit and the certification process. Bobby works at Advancing Wellness, a company that helps organizations achieve sustainable business results by advancing their individual wellness of their employees. And I want to let you all know that Bobby has traveled all the way from Pittsfield to be here with us today.
And I stayed at a Holiday Inn Express, so I'm ready.
So we really appreciate her traveling here. And we also have Lisa Irk and Claire Blaze from the Massachusetts Department of Public Health with us today. So we're excited to have them share with you some model worksite wellness guidelines and best practices. And to wrap up my piece, I also want to take a moment to thank the Hudson Economic Development Commission, the Assabet Valley Chamber of Commerce, the Marlborough Regional Chamber of Commerce, and the MetroWest Chamber of Commerce for co-sponsoring today's event. I think it's a great partnership, and hopefully we'll be able to continue to provide resources and events and support this great work that our local businesses are engaged in. So, thank you for listening to that little speech, and I'm happy to turn it over to Bob.
I'm going to stand, if that's okay.
Please,
I think it's the
by all means.
ionized water that gave me that new energy.
energy.
Ionized water, there's a couple bottles, and there's cups.
And you're good to go, huh?
Yes. So, thank you very much, Amanda and MetroWest team, for inviting me out here and the rest of us today. Before we get started, I just would like to get a sense of who's in the audience, because you're going to listen to this, to our presentation, our discussions today with different ears. So, do we have people here from small business, representing small businesses? Okay, a few. How about social or community service organizations? Okay, insurance brokers? Okay, okay, good. So, gives us some idea. I guess the bottom line is that where we live, work, and play matters. And all of you you are the community. You're a snapshot of it. You're trying to do some good work out there. And it's important really to all of us because where we live matters. So we're going to go through and talk about the small business tax credit. But just to set the stage, as I drove down the pike just yesterday, there's a big 18-wheeler in front of me. And on the back of that 18-wheeler was a big arrow. And it said, our number one asset sits 53 feet ahead. So I thought, who is that, I wonder? And so I drove by the truck, and there was a big arrow, and it pointed to the cab, and it said, our number one asset sits here. Join a company that cares. So I thought, for a trucker, a trucking company that might have 2 trucks or 200 trucks, this company clearly understands that their employee is their number one asset. And for all of us out there, employees in small businesses and large businesses really make the economy go around. There are 19.6 million Americans working in companies with less than 20 employees. So when you think about that figure, it's staggering. We can't have a discussion about community and worksite wellness that reaches into our community without talking about those small businesses. So we're going to talk a little bit about that today, and Amanda's going to be the clicker. Click, click. So we're going to talk about the tax credit. We're going to talk about the certification process, the model guide, and we're not going to talk about advancing wellness small business approaches, but there's a handout out there for you later. So let's talk about this 2012 legislation that kind of started this. You've all heard about the Affordable Care Act and all of that. And this, back in August of 2012 was signed into law, an act improving the quality of health care and reducing costs and increasing transparency, efficiency, and innovation. So this was the next big step for Massachusetts. We've been leaders across the country in how to adopt and move these health and wellness programs into communities. We all know that the healthcare system is broken. If you've had to use it lately and you've tried to, or if you looked at your bills, you know that they're not as transparent as they could be. You know that you oftentimes have lack of access in getting to a dentist or to a physician to get an appointment. We have lots of problems, and we have this chronic disease crisis out there with 21 million baby boomers moving into this healthcare system. So we needed something to work. So this is really the next stage, and the key provisions in this legislation was really about trying to get our hands around this health cost growth and coming up with a long-term plan for that. It's about trying to become more transparent and understand our systems and see who's accountable, and hold some accountability. So if a hospital discharges a patient before they're ready to go home, and that patient ends up back in the hospital, who is accountable for that? Is that because they were discharged too early? So again, starting to think about how to look at the big problems in the healthcare system and do something about it. Again, investing in a healthy future for the Commonwealth is about the work that we all do. And looking at this healthcare system, it's the system that we're going to use for our care as we get older. It's the system that our families and our parents and our friends and family are using now. Access to essential healthcare services, primary care crisis at hand. I know out in Berkshire County where I'm from, we are far behind the average number of physicians that we need to deliver good care. You can't find a doctor. Not only that, but Medicare is making decisions now and moving people off of their payrolls, and Medicare recipients now are trying to figure out where they're going to get primary care. So we have a crisis in that area as well. And then administrative simplification. We're looking at electronic medical records and how we can all communicate together, information systems that support that. All of that is part of this legislation. So they've invested an awful lot of money, $60 million over the next 4 years. And you're going to start to see these dollars being funneled into your communities through some of the MetroWest moves, some of the mass in motion stuff, through some of the work I think that Claire and the DPH is doing around diabetes prevention programs, My Life, My Health, lifestyle change programs. All of these things are going to start to trickle down because we have to do something about that. There is now a new wellness tax credit that actually the application goes live today. This is for businesses to implement recognized and evidence-based programs. And we'll talk a little bit more about that. It requires the DPH to develop a guide for businesses who are trying to learn how to do these wellness programs, really without not a lot of resources. If you look at small businesses, they're especially challenged because all of the resources usually are focused on delivering their product, whatever that is. They don't have HR structures. They don't have a lot of liquid resources to move around. It also requires insurance companies to kind of ante up and provide a minimum adjustment for businesses that really start to adopt these programs. And we're talking about evidence-based programs that have demonstrated return on investment, which means they help to save cost and improve quality of life for the people that work there. So the wellness tax credit, we're really fortunate today because we have Lisa here, and Lisa actually worked on developing that tax credit. So it's always nice when we have inside information. So I think we have inside information today, and that's good. But what this tax credit really does is it encourages the adoption of evidence-based workplace programs. These are not the programs of the 1970s, which is, let's just do something that feels good. Let's bring a yoga instructor in. Those are all great programs. But this is a special set of wellness concepts that are pulled together and really deliver good outcomes. The tax credit specifically gives small businesses reimburse them a tax credit of 25% of the costs associated with implementing a certified wellness program. At the end of the presentation, I'm going to give you a website. All of this is outlined pretty clearly on the website. It gives employers a maximum of $10,000 per business in a fiscal year. So if a business spends $4,000 on wellness activities, they'll get a $1,000 tax credit. They have $15 million to spend this year to allocate out to the businesses across Massachusetts. And they really wanted to focus on employers that have 200 or fewer employees. And they're actually, it's going to be kind of a first come, first serve. You know, you need to get in there and start the process and be engaged in it because they only have a pot of $15 million to allocate out. They are especially going to be interested in employers that have less than 100 employees. So then when you start to think about what is this, so those are the big criteria, and there'll be more about that, but what is the wellness program, and what does it have to consist of? Well, we know that it needs to provide a safe workplace that protects and promotes health, that is really designed to improve individual employee health. And part of that is the work site, the workplace that our employees work in. You can't send a changed employee that you spent money on, you know, getting into programs, helping them lose weight, into a work site that's not supportive of that. Nor can you send that employee home into a climate where they don't have good processes in place to be healthy at home, or into a community that doesn't support some of what they're trying to do. So if you tell them in an individual, you send an employee to a weight management program, and you encourage them to eat healthy in smaller portions, and they go to restaurants where that's not an option, or they can't find a farmer's market in their geography, it's going to be harder for them to do that. So we're talking about doing and implementing these programs as a community, and businesses are a very big piece of that. In the Berkshires, 65% of employees are connected to a work site. So if we can start to initiate programs in work sites, we reach a big piece of the community at large. These programs need to identify and address the specific needs and health risks of the employees. So you need to know who your population is. If you have 100 employees, roughly we know that 33% of them are going to have high blood pressure. And of that 33%, likely there'll be at least 1/3 of them who will be on medications and it won't be working. So it's helpful to kind of know your population. We know if you look at some of the statistics that if you work in in a work site that allows smoking, that likely your smoking prevalence rate is going to be about 18%. But if you work in a smoke-free business, that could be as low as 6 to 7%. That's been our experience. So we know that you need to address the specific needs of the population. How many smoke? How many are overweight? How many have depression? How many come to work with things like that make them not be as productive as they could be every single day? So you get up, you have a fight with your teenage child, you have a fight with your husband, you have a mother who is sick at home and you're trying to manage that plus your job. How productive are you at work that day? So you really need to start to think about how to address the specific needs of the people who are working in these work sites. Work sites don't need to do this all alone. And I'm going to bring that up now because if you have a work site with 20 employees, it could feel overwhelming. The good news is that you now are seeing, because of the money that's coming into communities, a community of resources to help you do that, which is why the MetroWest and the Worksite Wellness connection is so important. Yes, offering awareness and education programs that make this health information available is great.